Hello everyone, welcome to SE Intelligence channel. I'm Davis. I'm a physiotherapist, and today I will provide you with the best hand exercise to decrease spasticity and regain your hand function. Most people will have upper limb dysfunction after stroke, especially hand dysfunction. The strength of the hand will weaken and the muscle tone will gradually increase. If your wrist and hand stays in a certain position, the muscles will get short. Some people might be in a really flexed position like this. Some people might be just have some finger or wrist tightness. If this happens, you need to do some stretching exercise to get a range of motion back. Now, I want to show you a few exercises for your wrist and hand. Exercise 1. Stretch the flexors of wrist and hand. Let's begin by getting clenched fist open. One of the best techniques that I found for opening a clenched hand is doing something off the edge of the table. I want to pull my thumb out from inside my fingers, and most of the time, I want to protect the joint of the thumb. So, never yank on your thumb or try to hyper-extend it. Try to grab this bony area or the meaty area. Try to pull your thumb out a little bit, and then I screw my hand underneath my fingers and slowly work the fingers out. And then you can use the edge of the table to stretch your wrist and your hand. Next, pull out your fingers out and take your unaffected hand on top of your affected hand. The key point about stretching is you need to sustain for at least 30 seconds. Exercise 2. Stretching the thumb. You need to stretch the thumb in two directions. One direction is out to the side, almost like you are giving a thumbs up, and hold it for at least 30 seconds. The other direction that you want to stretch your thumb is down or towards your palm. It's really a good stretch for the web space right here. Exercise 3. Comprehensive exercise to reduce muscle tone. First, clasp your hand like this. The thumb of the affected hand is on the top. In this way, you can use the unaffected hand to help the affected hand to do more stretching exercise. You can stretch the wrist flexors like this, or like this. And you can stretch the wrist outer and the radial muscles like this. And also, you can stretch the forearm rotators. And furthermore, you can stretch the shoulder internal rotators like this. Remember to hold each stretching for at least 30 seconds. If you feel too difficult to do this exercise or too hard to insist, I would suggest to use Syrebo hand splint to prevent contractures and minimize soft tissue shortening. With traditional static splint on the market, when the client exhibits increased muscle tone or associated reactions, hit or her fingers want to flex and pull out of the splint. This results in pain and joint damage. With the Syrebo hand splint, we have a dynamic energy storing hand plate. Therefore, when the client exhibits increased tone, the fingers will move into flexion to protect the joints. And when the patient relaxes, the energy storing hand plate will safely reposition the fingers back to a neutral position while maintaining a light stretch in the finger flexors. In addition, the angle of the wrist and the thumb can be adjusted. For example, you can place your hand in a neutral position or in a functional position. Okay, let me briefly demonstrate how to weld Syrebo hand splint. Step 1. Check your extension angle of your wrist, and then adjust the splint angle to fit the angle of your wrist. Step 2. Insert your forefingers into the holes, and then wrap the wrist strap tightly. Step 3. Bend the thumb tab into a comfortable position and wrap the thumb with the strap. Step 4. Loop the strap around the wrist and secure it. Step 5. Secure the fingers to this hand plate with the strap. Stretching is not enough for your hand to gain more function. You need to do more exercise. Without the guidance and help of the professionals, it is very difficult and inefficient for one person to complete rehabilitation training at home. So I suggest you use some intelligent rehabilitation equipment to help you. For example, the Syrebo hand rehabilitation robot often stays in hospitals, and we can also use its home version to continue training at home. It is suitable for patients with hand dysfunction caused by different conditions, such as stroke, peripheral nerve injury of hand, orthopedic surgery, spinal cord injury, cerebral palsy, and so on. It will help us to improve joint mobility and hand function. What we are looking at is a pneumatic hand rehabilitation robot. It's small and portable. It has a host, a power glove, a date glove, and a wrist pillow, and a small training ball. Now, let's see how to use it for hand function training. On the host, you can choose the training mode and set in the training parameters. Before training, please insert the power glove and the date glove into the corresponding interface. Okay, let's go. First, turn on the power button. Click this mode switch button. You can choose passive mode or mirror mode. In the passive mode, you will need to wear the power glove on your affected hand. The power glove will take your affected hand to do flexion and extension, and the time of flexion or extension can be set on the touch screen on the host. The default total training time is 20 minutes. Okay, let's start. In the passive mode, will need to perform motor imagery. Imagine that you are completing flexion and extension movements by yourself, which is very important for the reconstruction of neural pathways. You can also use this mode to do some task-oriented training. For example, you can grasp some small object or perform object transfer training. You can also choose to train in a mirror mode, or you can call it bimanual mirror training. In this mode, you will need to wear the DIT glove on the unaffected hand. If you have difficulty wearing it, you will need the help of your family members. When the unaffected hand performs flexion or extension, the affected hand will perform the same movement simultaneously. In this mode, we can also perform task-oriented training or bimanual task training. Bimanual mirror training can help us activate the mirror neuron system and train our brain to regain control over our hands. Let me demonstrate. Thank you for watching this video. Please follow CE Intelligence now so that you will get more exercise for stroke rehabilitation. Have a nice day.